Hello, everybody. This is Dr. Vinod Pili, one of the uh, PGY2 internal medicine residents at Sinai Grace Internal Medicine Residency Program. This is a research study uh, um, presenting in the form of poster. The title of the poster is Are electronic cigarettes less hazardous than tobacco cigarettes? Introduction. Vaping or e-cigarettes have gained a lot of popularity, especially among former cigarette smokers or people who are trying to quit smoking. This subset of population tends to believe that e-cigarettes are somehow safer. In fact, e-cigarettes contain many chemicals which have precarious health effects that needs to be investigated. This report highlights the hazards of vaping or e-cigarettes as compared to the regular tobacco use. So what we did was we conducted a literature search on NCBI database using keywords e-cigarettes health and side effects for this report. The different studies where one was systematic review, another study is prospective cohort study, and another study is randomized control trial that looked at the health metrics of e-cigarettes versus tobacco and e-cigarette efficacy on smoking cessation. What we found was Poloso et al. Did PFTs on a sample of e-cigarette users and control participants who never smoked and compared their FEV1 and FAC and their fraction of exhaled nitric oxide and carbon monoxide. This small study reported no difference in lung function tests and respiratory profile at 3.5 years between daily cigarette users and non-smokers. They also did lung HRCT on smokers and did not detect any lung damage at 3.5 years of follow-up. Um, we should be careful with this interpretation from a small observational studies. The second study is systematic review by Callahan Lyon, published in Tobacco Control, reported the results of 44 studies that reviewed the health effects of exposure to e-cigarettes and their aerosolized components. According to the systematic review, exposure to e-cigarettes or e-cigarette aerosols led to the following: no change in carbon monoxide level or nicotine level, reduction in fractional exhaled nitric oxide, increase in respiratory flow resistance and impedance similar to the smoking effect, lung function unchanged, cardiac function unchanged, CBC and inflammatory markers unchanged. The systematic review could not provide a final answer on the health hazards effects of e-cigarettes because of the small studies involved and the heterogeneity in the design and the variability in the e-cigarette components. However, based on the review, the author could not conclude that there is long-term safety with e-cigarettes. A meta-analysis would provide a better and more objective assessment and a clear evidence. Figure 4 here shows data from the study on the effect of smoking cessation. E-cigarette users had twice the success rate of smoking cessation as typical nicotine replacement therapy and had a high compliance rate as well. When comparing PFTs between e-cigarette users and non smokers and seeing no statistical difference, it would appear that e-cigarette use is safer than tobacco use. However, more studies are needed looking at the long-term side effects of the various chemicals before this question can be answered with accuracy. References, here are my references, and thank you so much for giving me this opportunity.